My name is Rebecca Roush. I was diagnosed with breast cancer. And one of the things that's changed since treatment is that I want to do more gardening. I want to raise more vegetables. It's soothing to me.
Our angel.
Good to see you. Look at this hair.
My GP asked me if I'd be interested in participating in what she called the Nurse Navigator study. And she talked to me about it, and it sounded good because I want information and I wanted to know as much as possible about what was going on with my body and what the treatment was going to be. I started having weekly phone conversations with my Nurse Navigator, Lynn.
We have a very patient-centered focus team approach anyway, but this puts somebody sort of at the cog of the wheel along with the patient, so that, you know, you had one person that you could go to instead of just not knowing where to turn.
I chose to do chemo, and the strangeness of that never left my mind because I was always aware physically of the fact that I was poisoning my own body to curative cancer. The wonderful thing about my Nurse Navigator, Lynn, throughout all of that was that I would tell her that stuff and she would understand completely.
Patients got better, more relevant information. The biggest finding was they felt supported emotionally and socially, and they felt that their care was better organized and better coordinated.
You'll have at least 2 surgical drains. Folks really liked the proactive aspect of the phone call instead of them having to call in because they had a problem. The fact that we were reaching out to them, asking them how they were doing, how they were coping, was just a turnaround of the usual way that people interact with their medical team.
The navigators were familiar with group health. They had access to patient medical records, so they could really integrate with the team and other providers. They could talk to the providers directly. They could be present for patient appointments. So I think it really provided more of a seamless experience for the patient.
Our satisfaction really comes from reading the responses of the patients.
I went through diagnosis and surgery and treatment, and now I'm getting on with my life.